Good evening, everybody, and welcome to the New Teeth Now webinar. I am going to remove my mask for clarity so you can understand me and Dr. Richards better tonight, but we are socially distanced, so not to worry. But my name's Bianca, and thank you for joining us for the New Teeth Now webinar. I'm here with Dr. Richards, and tonight we are going to be talking all things dental implants and all about the New Teeth Now procedure. We're going to jump right into a quick video about our protocols with COVID-19 and what we're doing at the facility.
Caring for yourself and others hasn't been easy lately, but we want to remind you just how important it is to care for your smile.
At New Teeth Now, we're ready to help, and we're taking every precaution.
We're practicing social distancing and checking everyone's temperature.
All of our employees are wearing masks and during procedures are in extensive personal protection to keep you safe.
Now's the time to get the smile you've always wanted. Call to learn about our specials and visit newteethnow.com.
So that is our bit of our protocols of what we're doing to keep everyone safe so you can have happy and healthy smiles. So we will move into a bit about Dr. Richards. So he is a board-certified oral and maxillofacial surgeon since 1982. You have over 40 years of dental implant experience, and you're one of the innovators of New Teeth Now. As an innovator of this process, why do you feel it's so important to have this option for your patients?
Well, it's an option that not many other doctors offer. So, and it's an option that not many dentists know exists. And so not many people do what we do, which is shown to us daily by the phone calls we get. I just took care of two people from California. As you know, I think Dr. Kirkpatrick saw a guy from California.
Yeah.
Before that, there's still a gentleman here who came from Louisiana. We just took care of a guy from Kansas. So we have another lady from Alaska coming. So what we do, not many people do at the volume that we do it. We take care of 25 people a month doing this procedure, what we call the New Teeth Now procedure. And so not many people do what we do. We do a lot of it, so we're very good at it. And we have a procedure that works every time. We have our own lab. We'll go into all that a little bit later. And so time and time again we have people coming in and say that you can't do what you do because so-and-so oral surgeon or periodontist or general dentist down the street said you're false advertising, you can't do what you do. We do it every day. We do a lot of it. So what I would like to give you, the consumer watching tonight, is I'd like to tell you some stuff nobody wants to tell you, maybe give you some pearls, some questions to ask other dentists or periodontists or oral surgeons, and educate you as much as is possible in this short period of time about what it is that we do.
This is a fixed upper hybrid, and this is how you place the implants and the implant supported teeth. So can you tell the viewers a little bit about what they are looking at?
So we're talking about a prosthetic device that's similar to what you see here. And it's basically a bridge. It's not individual teeth. It is a prosthetic device that looks like teeth. It's not teeth, but it looks like teeth. It chews like teeth. But it is a one-piece fixed bridge that is screwed down to the implants. And we do this in the upper jaw, and we do this in the lower jaw. And so that's what most of our conversation tonight will be about, this. And it is a hybrid bridge because the implants do not have to go where the teeth need to go. So there can be a kind of like a third-degree heart block. One side of the heart doesn't know what the other side of the heart's doing. They're completely separate. Here, the implants go where the bone is. The teeth go where the teeth need to go for the person to look good, for the teeth to be in the middle of their face and vertically where the teeth need to be. So that's what makes it a hybrid bridge rather than a normal implant supported tooth bridge. And that's what you're looking at in this slide. You have Superman eyes. You're seeing the implants. You're seeing through the gums, through the bone, into where those 6 implants are. And then you're seeing the teeth in color, which is what I just showed. And that doesn't come out. It's screwed down. It may be removed for cleaning purposes or repair. It's not cemented. If it's cemented, then very difficult to remove. So you don't ever want to have one of these cemented. I've had to cut 2 cemented ones off in the last 6 months. Both, they weren't done here, they were done up in Michigan actually, both of them. So if you're thinking about doing something like this, make sure it is screw retained. That would be my first pearl for you tonight.
Yeah, that's great. And then for the lower hybrid, it's basically the same thing.
Right.
Yeah.
A lot of people who get these, most people who get these types of prosthetic teeth have a lot of bone loss from periodontal disease. That's why they're having the procedure. They have either lost a lot of teeth from periodontal disease or they're getting ready to lose a lot of teeth from periodontal disease. And so the teeth have to be the normal size, and then the gap between the real gum line and the teeth is filled in with artificial gum. So some of these prosthetic devices will have more of the pink porcelain and others will have less, depending on the amount of hard and soft tissue that the person has lost. This has minimal amount of artificial gum tissue. I think Roger's got a good shot of that. You can see that well. So.
And a lot of people that I talk to on the phone, they're concerned that like you can see the gums being artificial, but you really can't. Even if you lose a lot of bone, it looks extremely natural. You would not know that it's artificial.
You know, most people smile and they show their teeth. Most people don't smile and show all of the teeth plus all of the gum tissue. Mm-hmm. So you figure if you're looking at this, you know, the lip line when a person smiles is going to show the teeth. Some people don't show all of their teeth. Yeah. Some people show all of their teeth. Some people show all of their teeth and maybe a little bit of gum tissue. It's the outlier person who shows all of their teeth and like a 1/4 inch of gum tissue. If they're doing that, then there's typically something else going on with the jaw. The jaw may have grown too far down vertically or something, but that is rarely a problem that the smile would be so big that it would expose the junction between the artificial gum tissue and the real gum tissue.
Right, so
that's typically not a concern.
For the New Teeth Now procedure, I'll just briefly go over what it would look like. So first, the patient is put under a deep sleep with general anesthesia for a pain-free procedure. If they have teeth, they are extracted, and then the surgeon will place the implants. While the patient is still asleep, he will also take impressions for the lab to then customize the teeth. The patient will wake up in a private recovery room and recover for a couple hours while the in-house lab's fabricating the teeth. And by the end of the day, before they go home, the teeth are placed in the patient's mouth and adjusted. So this all happens in one day.
All in one day. So the typical person would come in the morning, and we would, the procedure would start around 8:20, 8:30, and typically we would finish by 12:30, 1 o'clock. Mm-hmm. And it takes a couple of hours to wake up from the anesthetic fully. And then it usually takes our lab about 3.5 hours to complete the fabrication of the initial temporary bridges that will be put into the mouth that afternoon at approximately 4 o'clock. And then the person is free to go after that. So we like to look at this as you see it in the 3 rings. Most people don't have the surgeons, the anesthesia department, a restorative dentist, a full service lab, all in one house.
Right.
We do. So there's no coming to our office, driving to the restorative dentist office, both of those offices interfacing with an outside lab. We have everybody here. It's a huge benefit. Communication, quality control. Communication and quality control are key benefits when you have the restorative dentist and the surgeon in the lab all in one spot. I mean, I cannot overemphasize how important that is in communicating, because these are complicated procedures.
Yes.
And it's not to be taken lightly, and when you're dealing with people spread out all over town, it can make things more complicated. Right.
And also for the ease of the patient, you're not having to worry about which office you're going to on what day. You just go to one place.
Right.
And this is our actual building. So we have the lab in the far back there on the second floor with the restorative doctors. They're right across the hall from each other. And then the ORs are kind of
just below the
right
lab.
Underneath them, right? Yeah.
Right.
So it's a large facility, and that's how we're able to make the most smooth and efficient process for all of our patients. So we will jump into a little bit of patient testimonials, and this one is very special to us just because of what kind of transformation we saw out of London. So he was born with a condition where his adult teeth never grew in. So he wore a snap-in smile, which did not function well. So he had a lot of embarrassment growing up. And he came to us, I think when he was 19, right? So he'd been searching.
Something like that, yeah.
Searching all over for a dentist that could help him. And he finally came to us. So we're going to hear a little bit about his story.
There's no fear now. These teeth are so strong and durable that I don't really worry now.
It just was nonstop hospitality. You wouldn't have thought you were at a dentist, I'll tell you that. You would have thought you were at a 5-star hotel.
So I first found out I had a problem with my teeth at around 3rd grade. And then I started to lose teeth around 4th grade. I was in the cafeteria and I took a bite out of my cheeseburger and my teeth just came right out into the cheeseburger. And in front of my friends was this little insecure kid.
Being that insecure and self-conscious will affect you in so many different ways. Emotionally, physically, everything. It will affect you and it will change you.
And I went to dentist after dentist after dentist, and they told me, I'm sorry, we can't help you.
We've been to many, and never have I ever experienced anything like I've experienced with New Teeth Now.
The first time I met Dr. Richards, I had my doubts. I walked in there knowing that he's probably going to say, I'm sorry, we can't help you. But he didn't do that. He looked at me and he reminded me of how many patients that he's done with bone loss, and he assured me that he could get plenty of implants in with plenty of support and it wouldn't be an issue.
He made me feel so secure. I only met the man one time and knew that this is where we were going to go and who was going to perform this procedure on him.
And I almost felt like I was in a dream. Like, this is exactly what I've pictured ever since I was young. And he really just made me feel comfortable and just relieved that, it's possible for me.
From my perspective, you'll get traditional implants in the front, and you'll get some zygomatic implants in the back. We did one just about like this yesterday. You'll have a set of fixed teeth this afternoon without any bone grafting. You will not have to take those teeth in and out.
Oh my gosh. Oh, this is crazy. Oh, I don't even feel like I'm looking at me. Oh my gosh. Oh, this is so insane. Oh wow. I don't even know what to say. I just feel like there's a different person in the mirror. The biggest part about these is not being able to take them out, not having something that can come out. Because there's so many times in my life where, they've almost fallen out, it means,
That's all gone.
So I don't have to worry about that anymore.
Yeah.
I don't have to hide anything. But
Sign of relief, joy, all the heartbreak and the heartache left in a sense. And all I felt was just gratitude.
This is always what I pictured, that there was going to be somewhere I'm going to go when I'm old enough, when I'm 18, and they were going to completely do my teeth and make the smile exactly how I imagined. And now that I have my teeth fixed, I feel like I have so much ahead of me. First things first is college, because this whole entire time I've been doing online classes up until I got my teeth fixed. And so I get to go into college with confidence and take my classes and make new friends and not have to worry about that. I can go to the basketball court and play basketball without any issues and not have to worry about them falling out, not have to put some type of glue that's super hard to clean out at the end of the day. This one is a really big deal. I went on a roller coaster the other day. I made sure to just smile through it and have my mouth open and just like let myself live like a little bit. And that's one of the biggest things, just that new confidence and not having to worry about them falling out and just experience life at like my fullest.
Our mission at New Teeth Now is to help patients overcome severe, long-term dental problems. We've helped thousands of people regain their health, happiness, and confidence, and we can help you too.
The teenager I knew had now suddenly blossomed into a confident, happy, secure young man.
New Teeth Now really did like change my life completely, and I just have so many plans for the future, so much hope again, and that's something I'm so excited to explore. Really.
You know, it's humbling to know what an impact, and I've said this before at these webinars, it really is something that we do every day, that we consider to be easy, routine, can have such a profound impact on someone. It really,
Yeah.
it's a good feeling to be able to do that for folks.
So London had zygomatic implants, which we're going to be talking about.
Right. We'll spend some time talking about that.
Because he had bone loss, and that will be our next segment, is kind of talking a little bit what types of implants people can have.
Right.
So for traditional implants, you'd be looking at, that's for patients without bone loss, usually 6 on the top, 4 on the lower.
Or 6 on 6.
Yeah.
I hate doing 4. I won't do 4 unless I absolutely have no other alternative. But these are procedures where in the upper jaw the sinus is favorable, the sloping of the sinus is favorable, and there's enough bone in the anterior to place traditional implants in a traditional fashion. And the same in the lower jaw, where there's enough height that we can get up over the nerve canal and angle the implants to avoid the nerve. So I would say that this type of treatment is maybe 60% of the people that we do.
Mm-hmm.
You know, come in, have enough bone to do traditional implants all the way around with tilted implants to avoid the nerve and the sinus.
And then these are zygomatic implants.
Well, not only zygomatic, but
Quad.
4 zygomatics with 2 extras, which, you know, these are probably 10% quad zygomas with enough bone to do supplemental traditional implants. I mean, that's really unusual. These are people who have been around the horn, so to speak. They have been told by multiple people that they don't have enough bone for implants. They have been given bone grafting options. I'll discuss that in a minute. But they come to us because they find us on the internet because we do a lot of zygomatic implants. So over the last 10 years, we've probably done 2,000 zygomatic implants. So these long white things that you see angling off to the left and to the right are zygomatic implants. So the zygoma, that middle word, zygoma, that is your cheekbone. The zygoma forms the prominence of your cheek. So if somebody punches you in the face, you get a broken zygoma, a broken cheekbone. That's where these implants go. So they come from the inside of the mouth, under the tissue, and they insert into the zygoma right here. So it's the eye is way up here, and these are down a ½ inch under the eye and back in this area. This bone's very dense, and so zygoma implants are very stable because they're stabilized on the zygoma end as well as inside the mouth. And they are ideally suited for people who have no bone. They're really ideally suited for people that have tall, skinny bone that's so skinny you cannot put traditional implants. They work for people who have just an upper jaw that's flat as a pancake, but they're not as well suited to that as they are the tall, skinny jaw. And they are the 100% graftless solution. Okay, I'm going to say that again. Graftless solution. No bone grafting with zygoma implants. Because the option is extensive grafting into the maxillary sinus. Extensive sinus grafting. And the problem with that, y'all need to listen to me now. The problem with extensive sinus grafting is, if it is successful, and they have a sinus, I do sinus grafting for other things, just not this, and you get some good bone that will support implants, those implants are going to be in the back. They're going to be back in the canine and back, because the sinus typically doesn't come up as far as the canine. So sinus lifting or grafting will give you implants in the back, but it doesn't do anything to give you implants in the front. So if you have 3 implants on each side in the back, and they're not even up to the canine, and you have this long segment from the canine to the canine where there's no implants, your procedure is going to fail. It is going to fail. It's going to fail 100%, and it's just a matter of time. And in the meantime, things are going to break because there's no support from the canine to the canine. So you have a very long unsupported cantilever in the front. Most of the time we're worried about a long unsupported cantilever in the back because of the sinus, but not with zygomatic implants. So zygomatic implants are the 100% graftless solution. You can hook teeth onto them the same day, and they can be placed in the front and in the back. So if you have no bone in the front and you have no bone in the back, you can have 4 zygomatic implants and have teeth the same day.
Yes.
If you go the grafting solution, you only get implants in the back. You may get teeth after a 1.5 years, 18 months, maybe.
It's a lot
and you
longer.
still won't have implants in the front. This concept is extremely important to understand. Legs on a table, they go all the way around the table. So you have a broad platform of legs on the floor to support the table. These teeth need the same thing. They need legs in the front, they need legs in the back. If you only have legs in the back, how can you expect the table to stay
To be
up if you
supported.
load up the other end of the table with no legs? It is simple engineering. So take that home, think about that. And that's
Yeah.
the pearl I'm going to drop on you about grafting solution versus the non-grafting solution.
And that's a very important pearl. Definitely. And we did have a question. Is this procedure's recovery time different from a traditional implant procedure?
I would say there's a little more swelling, but the number of days that it takes to get back into action, no. But you may have a little more swelling because we have to reflect a little more tissue up this way. So there would be a little bit more swelling up into the lower eyelid area. You're already going to have some swelling out here in the cheeks anyway. It's just a little bit farther up this way.
And what does that recovery time look like typically?
Well, I mean, on pretty much everybody, the swelling goes up for 2-3 days. It comes down over 2-3 days. The level of discomfort is mild to moderate. I saw 4 people today that had been done just within the last 10 to 14 days. I always ask people, how many prescription pain pills did you take? The typical answer is 2. And then I was on Advil and Tylenol.
That's great.
So, you know, regardless of whether you have zygomas or not, it's just not a big big deal. A little bit more swelling right up in this area though. And some people bruise and some people don't bruise. And some people bruise a little and some people they look like raccoons. They bruise a lot. And you know, it's hard to tell who's going to bruise. And that's not just with zygomas, that's with anything. And so bruising could be considered part of the recovery because you want to get back to work or
Yeah.
and you know, if you're a woman you can put the heavy foundation on, I guess. But you know, if you're a man, that is a little
can't
more
really do
difficult.
that.
Yeah. And but that's true even with traditional, regular lower jaw implants or upper jaw implants, not necessarily zygomatics.
This is just another, I guess it's an illustration of the ways that you can add additional support in the front if needed.
Yeah, and those pictures also sort of point out the point that I was making, particularly the left picture, because of all of the zygomatic patients that we see and do zygomatic implants on, it's rare to have one where you can put an implant in the front, like in the center picture, or you can put two implants in the front, like the right picture. They're almost all like the left picture, where there's no bone in the front, no bone in the back, which supports the point that I was telling you. You can see in that left picture that there's a zygoma implant in the front, actually a little bit anterior to the side of the nose, and there's a zygoma implant in the back. So you have 4 legs on that table. If you go with the grafting, you have nothing in the front because there's no bone in the front. And to do grafting in the front to gain vertical is something that is just not predictable. And you want to talk about recovery time? Going to the hospital for a hip bone graft to graft to your jaw, you're talking serious recovery time. So
Yeah.
zygoma implants are
That's
in the
right.
hands of people who have done enough of them to get past the learning curve and know when and where to do them and when not to. Then zygoma implants are the graftless solution, and it's the way to go if you have an x-ray like the ones that you see here. I know I'm getting long-winded about that, but these are huge,
It's important. Yes.
points, because a lot of doctors are just now getting into the zygomatic arena. And maybe they shouldn't be there. You know, you got to be very aware of who you're dealing with. Just because someone does implants doesn't mean they do implants. If you want to have your heart done, you go to somebody at a big
specialist.
hospital that does 1 or 2 every day, or their team does. So you need to think about this like that. If you have a complicated situation, you need to be dealing with people who do complicated things every day.
Speaking of a team, this is your team. So these assistants help you with surgery, with post-op, with everything.
Right.
They know what they're doing.
You know, that just kind of brings me to another point, that at the end of the day, you know, patients will thank me and all that kind of stuff, and I say, listen, it took 15 people to do this. It wasn't just me, okay? It took me, those people, took the implant treatment coordinator that you saw when you first came in. It took the anesthesia department. It took Dr. Dibbs and his assistant in the prosthetic department. It took Terry and Anna and the other people in the lab. So it takes that many people to pull this off. The lay person who's thinking about doing this has absolutely no idea the level of skill and the number of people who have those skills, anesthesia skills, laboratory skills, the surgery skills, all of that, the prosthetic skills. Most people have absolutely no idea what it takes to pull this off. You know, we make it look so simple, but it really isn't so simple.
Takes a team, that's for sure. And this is our anesthesia department. So we have Jack and Kim, who have over 25, 30 years of experience, that are in the OR monitoring the anesthesia the whole time. They're excellent.
CRNA, Certified Registered Nurse Anesthetist. So these are people, Jack's in his 60s, Kim's in her 50s. They've been around doing this for a long time. So they're registered nurses who do another 3 years of training to do anesthesia.
And then this is Dr. Dibbs. So basically everyone that Dr. Richards has been mentioning, we now get to see them. So he is one of the restorative doctors and prosthodontic specialist. And so he works with patients in designing their teeth and fitting them and all of that. So we're going to watch a video about the dental lab and how Dr. Dibbs collaborates with them.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient, that you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
So it really is so awesome what they can do when we all work together. And we'll show a picture of the in-house dental lab team so you can see them.
And so, you know, of those people, to pull this whole thing off, you have Terry and Anna, and then Pam, who you saw in the video, putting porcelain and the color and the staining, and Eddie, who does the computer design, and Jack, who oversees all that and ensures the quality control. So I mean, there's 5 or 6 people in the lab, plus Dibbs and his 2 assistants. I mean, there's 7 plus anesthesia plus moi and my 4. I mean, it's a lot of folks.
Yes.
A lot of folks.
Going a little bit into materials.
Yeah.
So this is a photo of a set of acrylic teeth which are laying on the bottom, and then a set of zirconia teeth that are sitting on top. And both of these teeth have been worn for 5 years, and you can see instantly the difference in the quality of the zirconia bridge and the acrylic bridge. The acrylic is stained, it looks worn out, it's just not in the greatest shape. And the zirconia look brand new. So can you explain a little bit, you know, that's why we use zirconia and
sure,
the differences?
Yeah. I mean, our first set of teeth that a person would get on the day of the procedure are made out of the acrylic. This is a full denture. Just a regular old full denture. Something that if somebody had all of their teeth removed, they would, and no implants or anything, they would get this full denture. This is the material that the first set of the temporary prosthesis is made of. And that's the material that you see the bottom set of teeth is made of this denture acrylic. And so, you know, it's porous and they break. And so the problem is they stain, they trap odors, and they break. And early in, before zirconia became in common use, everything was acrylic. And a lot of general dentists just shied away from this kind of work because all of the prostheses, the screw-in prostheses like you see here, the bottom one, they were all made of acrylic and they all broke.
Yeah.
And it became a headache because they were breaking all the time and teeth would pop out at the most inopportune time, as you can imagine. And so folks were calling and wanting to have them repaired, and that was a lab bill and that sort of thing. And I know that this is true because our first set of teeth, our prosthetic teeth, the first ones that a person gets on the day of the procedure, I just told you, they're made out of that same material. And when a person asks me at a consult, they say, well, you got to have problems. What's the most common problem that you see? Breakage of the temporary teeth. That's the most common problem we see. And luckily, a person is not in those teeth that long. I mean, they're in them for 6 months. Some people, most people, I would say 85% of the people have no breakage. And then another 15%, they'll break a tooth, break the edge of a tooth because they're chewing, and these teeth are bolted in. They're not, see, a denture is sitting on the tissue, so it's got like shock absorbers because it's on the tissue and it moves. When you bolt these things down to the implants, they're rigid, they don't move, and so now you're taking material, plastic material, and subjecting it to forces far beyond that which it was designed. And it breaks. I mean, it's all there is to it. But you can't build any, you can't build, it takes 4 days to make this. It takes 4 days. 1 day to mill it, 1 day to center it in a centering oven, and a couple of days for the technicians to put the porcelain and the stain on it. So it takes 4 days. So we couldn't give people zirconia the first day. That would not work. We are in the process of transitioning to milled first set of teeth same day. We've been working on that here amongst ourselves, trying to get a protocol, and hopefully we'll have something worked out pretty soon. But the acrylics, they break, they're porous, they wear out, they stain. They're not for the long run, they're for the short run.
And so the long run is the zirconia,
Long
which
run's the zirconia,
are the strongest material. They don't stain, they don't crack. They're like completely opposite.
They're a glaze. It's got a glazed porcelain finish. It doesn't absorb stains and odors. It's easy to clean, and it's very strong. So they work out pretty well.
When you're looking to have your final teeth, you want zirconia, because otherwise you'll be replacing the acrylics. So it's worth it to get the zirconia.
Roger, let's show them this. When I talked about milling the teeth, this is a block of zirconia, and these blocks come in different thicknesses. Some of the prosthetic devices are thicker, some are thinner, and so we can use thicker or thinner blocks to mill the teeth. So here's a set of teeth. They have been milled So this entire prosthesis is one piece. The teeth are milled full contour. So then this is cut away from this block and it goes into a sintering oven, I think for 8 or 10 hours. I'm not sure what the temperature is. And it undergoes a shrinkage and a hardening, and then it goes to the technicians for the color.
And they make them look all
Yeah.
like teeth.
That's right. So that's how that works.
So lots of great detail and information today. And so this is our implant coordinators. So if you come in for a consultation, you will meet with Dr. Richards and either Shauna or Debbie, who they both started as dental assistants and are now coordinators, so they know everything. And they're here with you every step of the way to walk you through the process. If you're coming from out of state, they can help plan like logistics and traveling and the coordination of being out of state. So they're really awesome ladies.
Right. They help with medical clearances.
Yes.
Coordinate medical clearances with our anesthesia department, and basically they coordinate everything.
Yes.
Yeah.
At a consultation, this is an open CT scan. It's included in the cost of the consultation, and when you meet with Dr. Richards, this will help him determine what he would be doing, and both of you will come up with he'll come up with the treatment plan, but you'll understand the treatment plan and know exactly what will be happening on the day of surgery.
You know, most people just want to know if they're a candidate.
Yes.
And we can look at the scan and within a few minutes tell them that they are or they are not, or if they are, what type of implants that are necessary. Traditional, tilted, zygomatic, based upon what their desired final outcome is. So the scans are also very useful educational tools because lay people who are not used to looking at x-rays actually can make sense out of the scans. These are cone beam scans. They're not CAT scans. They're cone beam scans. Very low radiation and very accurate. A lot of people want a copy of their scan, you know, particularly if we see a problem with a sinus. I saw a sinus problem today. We gave the person a flash drive of their scan to take to their primary care doctor to get checked out. So all of our scans show more than just the mouth and the jaws. They get back into the base of the skull and the ears and into the neck and cervical vertebrae. So all of our scans are electronically transmitted to radiology and imaging specialists who are MD radiologists who do what is called an overread. So they are looking at all of our scans to make sure that there's not some pathology, something wrong in some other area other than the jaws. We're familiar with the jaws, but I'm not familiar with the base of the skull and the cervical vertebrae and all of that other stuff that is on these images. And so that's important to know that all of our images are transferred to medical doctor radiologists who perform an overread and send us a report which we then send to you, the person who had the scan.
So now we will go into a little bit more about our patients and their transformations. So this is Bruce. He's from Orlando. He had a lot of pain. He could not eat the foods he loved. And since having the procedure, now he can eat anything he wants. And that is one of the common things that I see is people are just so excited to be able to eat, you know, their favorite foods that they're missing out on. And this is Shirley. She is from the UK, also had years of pain, couldn't eat the food she loved, and was also extremely self-conscious of her smile and how she talked. So we're actually going to watch a clip of Shirley's transformation.
You can't eat apples, you can't eat steak, there's all sorts of things you can't eat. I also couldn't eat sweet things. I was always at the dentist having something put back, or I was just in severe pain. I saw an out. Here was something that I could do, which was going to take away all the years of hurt, pain, and people looking at you like you don't take care of yourself, maybe. I know that's in your mind, but it's a big part of how you feel when your teeth don't look good. For New Teeth Now to give me a solution, it's just been life-changing. I didn't want anyone else to do the procedure but Dr. Richards, because I really, really trusted him.
So we put her to sleep, removed all of her teeth, trimmed up the bone and infected tissue, installed 6 implants in the upper jaw, 6 implants in the lower jaw, and that afternoon we put the teeth in, and she and her husband went home.
I really liked how Dr. Richards spoke. I liked how he behaved with people. My husband and myself got on with him really well straight away. It was the connection I needed. I needed to have spoken to somebody one-to-one, personally. Dr. Richards solved the problem. I wish I'd known about New Teeth Now several years prior. The fact that you can go there and come away with teeth in one day, to me, is just mind-blowing. Now I can just eat what I like. You know that really hard toffee that you can get with the chocolate on it? I just love that. And so many people compliment me and say how beautiful my teeth are, that it just made a huge difference to my life. I think I'll be a lot more confident again.
You know, she's just so confident now, and like many others, she really wishes she could just do it earlier. I've heard so many times, I wish I had done this 10 years ago. Why didn't I do this 10 years ago? So, you know, there's no time better than the present.
Yeah, the present's pretty good. Probably better than it would have been 10 years ago.
This is Crystal. She had painful loose teeth, and she was tired of covering her mouth, and her main, you know, concern was that she just felt like antisocial, like talking to new people, laughing, smiling. She was uncomfortable, but now she can. It's a whole different lifestyle. It's really dramatically changed the social aspect for her. And then Gladys is our last transformation, and she's from Tampa. She had difficulty chewing, and she had an infection, probably from periodontal disease. And so that was all cleaned out during the surgery. And so she had, oral health-wise now, you know, everything is cleaned out, and she has healthy teeth and gums, and she doesn't have to deal with embarrassment anymore. So everyone there's so many reasons, and a lot of times it's multiple, but there's just a huge transformation afterwards that we always see. And of course, as you've seen tonight, you are in such good hands with Dr. Richards. He can totally restore your health and happiness. And so really the next step is to give us a call if you have any questions. Our phone staff are very knowledgeable and can answer just about anything. And then if you're ready to set up a consultation, we would love to see you in our office. And so we just thank you for joining us tonight. Thank you, Dr. Richards, for being here.
Let me just say that, you know, if you'd like to communicate with me directly, that I have email. Jason over here could give you my email, and you know, you may have some question you didn't get a chance to ask, or maybe we didn't answer a question that you might have, but I'd be more than happy to chat back and forth either by email or even a phone call if there's some specific question that I could clear up for you.
That's awesome. But yeah, we just thank you for joining us, and we hope to hear from you or see you soon. Have a great night.
Good night.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.